Well, this is the news that none of us wanted to report or indeed to hear. But you'll remember in the first wave of COVID-19, part of the explanation for why the UK had such a high death toll was that many care homes faced a high exposure to COVID-19, and you eventually had about 27,000 excess deaths in care homes. Getting on for half of the total death toll during this pandemic was in care homes. And the hope was that if there was going to be a second wave, then at the very least, we would be able to protect care homes. You wouldn't see a big spike in cases in care homes. But I have got hold of some internal NHS data for at least one pocket of the country which shows that the story is, well, worryingly familiar, if anything worse than in the spring. It's for Leeds, and these NHS data show, and this line shows you the number of cases, active cases within care homes in the Leeds area. And what you can see is it rose very sharply in the first wave of the pandemic around April, May, June, and got up to about 150, 160 or so active cases in care homes in Leeds, and then came down. But just look at what's happened over the course of it is literally the last week and a bit. You've seen them rise incredibly sharply from around 20 cases up to over 200. So that now the number of care home cases of COVID-19 that we have in this area of the country, in Leeds, is actually higher than it was in the spring. So not only is there evidence of spread to care homes in Leeds, like in many parts of the country, we saw a rise in cases of young people of COVID-19, but it's now looked like it has spread in the community and has spread into care homes. But also just the absolute level is very high indeed. A few provisos. It may well be that the level is particularly high because we're doing more testing. There is more testing happening in care homes. And also it's worth saying what we don't know from these statistics is how many of these cases are residents versus the carers, the employees that work there. And I'm told that a chunk of them, potentially the majority, are people who work there, but we don't have that breakdown. What we do have is this, and it's unpublished NHS data. And it is very alarming indeed, because as I say, the hope was that care homes would be protected in the second wave. The hope was that you wouldn't see COVID spread from the community into these care homes where there are many elderly, many vulnerable people. But unfortunately, now we know for the first time that in at least one part of the UK, that spread is happening and the rise of cases is very worrying indeed.